Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
GraceMed Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at GraceMed, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. GraceMed Health Clinic, compassionate care for all.
Welcome, guys, to another episode of MedTalks. I'm Juvenava, Director of Community Outreach and Communications at GraceMed Health Clinic. We are still on the road in Topeka here at the Capitol Clinic, and I am with April from the Ronald McDonald House Charities. Hi, April.
Hi.
How are you?
I'm good. How are you?
Good. Thank you so much for joining us.
Yes, thank you for having us.
So the Ronald McDonald House Charities, it's been an organization that has lasted for a number of years.
Yeah, they just celebrated 50 years.
That's incredible. Mm-hmm. Can you talk to us a little bit about the mission of Ronald McDonald House Charities?
So the mission of Ronald McDonald House Charities is to provide housing for families that are having a child receiving medical treatment at a medical facility. The child has to be under the age of 21, but it's also for women that are high-risk pregnancy or families that are going through an adoption. They can also use the house.
Okay. Mm-hmm. How do you partner with other healthcare facilities or other organizations?
No, we partner closely with other healthcare facilities. So we partner closely with our hospitals here in Topeka, also Florence Crittenton, and there's a few other places that we partner with, and we provide housing for them, for families coming in to visit them. For Stormont Vale, they have the level 3 NICU, and so 90% of our families are NICU families, and so they have a baby receiving attention after they were born, and the families are outside of the city of Topeka limits, and so they need someplace to stay while they're with their child.
Okay. How do families get services through Ronald McDonald House Charities?
So they are referred by a social worker from the hospital or a staff member from that facility, and they can then come stay at the house. They're provided services with Stormont Vale. They provide transportation back and forth so they don't have to take their car. They can have transportation. We provide a hot meal for them, a private room with a private bathroom. We have 8 guest family rooms in our house, and so we can service up to 8 families at a time, all different sizes of rooms as well. So families that have siblings, they can come stay here as well and be close to their child.
Oh, that's nice. So it's a whole family environment.
Yeah.
That's great. What does a typical Ronald McDonald House Charities house look like?
So our house is actually fairly small compared to a typical house. Ours is a residential home that they built into the Ronald McDonald House. So it was built in 1906, so it's actually a historic home. It was the childhood home of George and East Gray, who's a staple here in Topeka. And so it is an old home and still has the original woodworking, light fixtures, stained glass throughout it. So it's a beautiful home. And so we are unique in that factor, but a lot of houses look like residential homes and even apartments. And so they look like a hotel, apartments. They provide everything that you would need.
Okay. So what does a typical day for a family look like?
So, in fact, our families, they can come and go as they want, and they can make their day how they want because, you know, when a baby needs to be fed, you know, that's their schedule, and so they work around that. And so I may not see a family out at all during the day. They can get up early, grab a breakfast bar, they head out the door, they're with their child during the daytime, they come back and they eat a hot meal and are in rest, and then they might be back at the hospital in the middle of the night for a feeding, and so they have that ability to come and go and have access to the house in their room at any time.
Okay. So what does a typical day for a staff member at the house look like?
So we're staffed 24/7. We always have a staff member at the house. Even at night, we have an apartment. So a typical day for me is I get there and I'm opening up the house for the day. I'm turning on lights, welcoming the families if they're awake. I'm doing laundry. We do laundry every day in the house. We provide laundry services for our families that they can do their own laundry as well. We might be turning on the coffee maker. And then, it just goes about that. We're welcoming donations and giving tours and working with volunteers, helping our meal makers get set up with the meal, that we can have a set time for them. We don't have set food times or meal times for our families, but they can come grab something to eat out of our kitchen at any time. So we'd always have a hot meal for them each day.
Oh, nice.
So yeah, it's a little bit different each day.
Yeah. What are some of the supportive services that you offer the families?
Like I said, a hot meal. We try to have a hot meal for them that's homemade. We provide the personal hygiene products that they would need. A lot of our families come in from out of town with nothing with them. They weren't planning to go to the hospital that day, let alone have a new baby. And so we provide everything that they would need while they're staying. We try to make it almost seem like a hotel stay until they can make it home. We even have full-size products for families that maybe aren't going to be able to make it home. We provide, like Stormont Vale provides the transportation. They do that with their security. So security will come pick them up and drop them off at any time of day. And so that allows a safe transportation option for them. We do have some clothing items. Through our community, we're able to give each family a baby bag full of brand new products to welcome them. And so they have diapers and wipes, lotions. That's all donation based through our community. And it gives them something to take home and not feel empty-handed when they go home. And then we have somebody that provides full-size Mary Kay products. That's the way her heart gives back to our families, so they have health hygiene products for them as well.
So you do have volunteers who come in, perhaps like provide services or goods. If anyone's interested in supporting the Ronald McDonald House Charities, how can they do that?
Yeah, so it's really easy actually to support us. If you're wanting to get on our website, it's just rmhcneks.org. And we have a whole tab there that says Get Involved. You can sign up to be our meal maker program on there. You can sign up to be volunteers. You can just stop on by and we can have a conversation. We do a weekly wish list that we post on our website and our Facebook with our most needed items that week to make the easier for our families. And then we also put out a monthly wish list for like each quarter so that there's a longer need. Our Amazon wish list so people can do donations online.
That's awesome. April, how many families have you served?
So since our doors have been open in 1988, we've served over 1,500 families.
Oh, wow. That's incredible.
Yes.
What's the vision look like for Ronald McDonald House within the next 5 or 10 years?
We'd like to be a bigger impact for our families. Our house, it's old, and so we have a lot of maintenance and upkeep with that. So, way in the future, we might be looking at improving that house, adding on to it, looking for a different area in Topeka. That's a big pipe dream, though. We're very happy where we're at. We're able to be close to both hospitals.
Yeah, that makes sense, but we can always dream, right?
Yeah.
Exactly. April, I know, working in a nonprofit, that sometimes we do this because we have a passion for it and a heart for it. What is your reason?
The passion, the heart for it, the families. I have not been in this situation where I've had a child receiving medical treatment, and same with the NICU, but my heart goes out to those families. Being a mom and seeing what these mom needs for support, that's what really drove me in. And I just caught the bug, and I want to be able to help them out in any way possible.
I was really excited to interview you and to learn more about the Ronald McDonald House. I remember doing the tabs from the pop cans and just even volunteering, just with my local church and other community organizations to prepare meals and all that. So thank you for all the work that you do for the families and for the community. Truly appreciate it.
Thank you. Thank you for having me.
Thank you for joining us. Thank you guys for listening to another episode. We will see you next time.